For people whose seizures are not well controlled, it's difficult to plan for the unexpected. Before her seizures were under control, Lourdes never knew when the next one might happen.
It's awful not to have your seizures under control because there's that uncertainty. I have no warning that it's coming. All of a sudden, I'm talking and then I'm gone. I have no idea what's going on.
Perhaps the most important way to plan ahead for safety is to understand what can bring on a seizure.
I know exactly what a seizure feels like, and I know exactly what brings it on. It's always when I'm either stressed out or overtired or a combination of the two.
The common triggers for seizures are sleep deprivation. Stress is one that's commonly talked about, and then missing or forgetting to take a medication if you're taking it for seizures is another common trigger.
Keeping a diary of seizures can help identify your triggers, and it might help you gain awareness of how your body feels before an attack. You might experience what is called an aura, but it's not the same for everybody. For Tamara, it's a physical symptom.
My leg starts going numb, and I can feel the numbness, so I know that I need to sit myself down and cancel any activities I have for the rest of the day.
But as Fred came to realize, an aura can also be just a feeling that something isn't right. That's why he got off his bike before his second seizure.
Because I was a little disoriented, and I clearly had felt that something was happening.
Oftentimes these auras are very specific to an individual and similar each time, and many times the patient will describe them in their own terminology, but it's usually an unpleasant sensation and occurs prior to the time where they lose awareness.
Not every patient knows that a seizure is about to start because of that aura, but some do, and it can allow them to do something like sit down or even lie down if they know they would otherwise fall during a seizure.
Fred is not only familiar with his type of aura, he also is aware of what might have triggered his seizures. Flashing lights at the airport where his first seizure happened, and flickering sunlight before the second one.
I have to be attentive to the angle of the sun and how much hits me directly in the eyes.
Both times Fred suffered a seizure in public, strangers came to his aid. If there's a next time, whoever helps him will have more information about what's wrong.
I have an ID bracelet that I got from a medical supply company that has the standard symbol on it and the word epilepsy in the back, which I thought would be the best choice for if I ever did have a seizure again for anyone attending to me, EMTs for example.
If an individual is at high risk of seizures, then it may be very important for them to have information available to someone when they can't speak for themselves, whether this is a bracelet or a card.
There are also ways to add protection by taking a close look at your home and workplace. Put away things that might cause injury during a seizure.
We spend a tremendous amount of time in the kitchen, the bathroom, and the bedroom, and we know there's things we can do to minimize injury, and that's very important.
Creating an environment of awareness and safety is especially important for parents of children with epilepsy. That includes communication with the child's school. Sometimes parents need to educate the educators.
Obviously, they want to be sure that the child has the same educational opportunities or the opportunities that best fit their developmental skills.
It's important that the teacher knows. It's important that the students know in class that this is not something unusual. It's something that happens to some people, and they're able to live with it in management.
Tamara has been able to arrange a school schedule that allows her to get the sleep she needs and minimize stress. She's grateful to her parents for working with her to replace fear with knowledge.
Well, my parents were just as scared as I was at first, and they've helped me cope tremendously.
The history of epilepsy is as old as humanity. Alexander the Great and Julius Caesar were described as having fits or seizures. In the past, seizures were believed to be a sign of demonic possession or some other outside force. Even today, people with this condition often face ignorance, even prejudice.
I think epilepsy still is a disorder that oftentimes there's more ignorance than there is knowledge.
There's a tremendous amount of stigma and a misunderstanding about seizures and epilepsy.
John O'Hurley believes that stigma was a terrible burden for his sister, especially when she had a seizure at school.
And it scares people, and kids can be cruel without meaning to be, but they can be. And so it's a very difficult thing to do, and it's very difficult for her.
That's why he works to get the message out that people with epilepsy can and do live full, active lives.
Many individuals with seizures and epilepsy are as on top of things as any of us, and in many cases more so.
Each individual needs to set his own course with the condition. Since his retirement, Fred no longer commutes to work on his bike, but he still enjoys riding in less stressful settings.
In fact, yesterday I peeled off 25 going on 30 miles in the hills west of Boston.
But each person's situation is different. Recreational activities should be discussed with the doctor.
I usually encourage patients to be physically active. I think common sense, don't swim alone, probably true for most of the people, not just patients with seizures.
It's especially important to talk about driving. No matter how well your seizures are controlled, the decision might be out of your hands.
That's a legal or state decision, and the patient has to abide by the laws in that particular state.
Women with epilepsy have an additional consideration: planning for pregnancy.
When a woman who has epilepsy and is interested in starting a family comes to the office, I try to talk with them a lot about the medications, the impact of medicines on the developing fetus, and try to plan ahead of time.
Another issue to discuss is how epilepsy is affecting your mental health. Coping with a chronic illness poses challenges for both the patient and the caregiver. Don't be shy about asking for help.
There are emotional and/or behavioral issues that need attention when somebody has any chronic illness, especially epilepsy. And so I encourage patients and their families to talk about that with their provider, and we try to arrange for help with those issues as they come up.
For Lourdes and Luis, managing epilepsy is a partnership. That makes a big difference in her attitude toward her condition.
And the times that I felt depressed or bad about myself, that I have this label of epileptic, tells me that you just take your medication religiously and you'll just like everyone else. Or people that have to take blood pressure medication, medication for diabetes, this too is manageable.
My advice to somebody who is just diagnosed with epilepsy would be that it's not the end of the world and don't let it scare you.
In pageants and on the air, Tamara is shining a light on epilepsy. Her story raises hope and awareness.
There's a lot more awareness now of epilepsy. A lot of empowered patients with epilepsy are helping to educate and to improve understanding of epilepsy. That's a very hopeful part of what's happening in epilepsy right now.
So overall, I think the horizon is very positive.
Epilepsy affects millions, but each person's management plan is unique. The key to success is learning what you need to know, working with your healthcare team, and making a positive commitment to your health.
Because management is the key. You can live a very normal, productive life with epilepsy.